The first case of COVID-19 subvariant Eris has been detected in a patient in Gauteng. It is responsible for the current new wave around the world and has been detected in South Africa, as I was just saying. Let's discuss this further now with the Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, very good evening to you. So a few weeks ago, when news of this new variant started to circulate domestically, the response from some of your colleagues was that there was nothing to worry about. Is that still the case?
Good evening to you, Temeke, and your viewers. And yes, that is the case. We need not be worried, and we do not need to panic, but we need to be aware that there is a subvariant of Omicron that is circulating around, dominant in the US, but in many other countries as well. But, you know, obviously the usual way of avoiding infections is all those public health measures that we always preach, and I think they're still relevant.
How does it differ from the variants that we've all come to live with? I mean, I remember the time when we were all trying to come to grips with Beta, and then there was Omicron, and eventually conversation even about the different variants and subvariants died down. Why is this one making headlines?
It is making headlines just based on one thing, that is, it is more transmissible than the others, but it does not really lead to severe infection or severe symptoms like the other subvariants. But like we always say, it depends on the immune system, the status of the immune system of each individual. For example, if you are having underlying medical conditions like kidney failure, heart failure, you are using cancer medication or having cancer, certain cancers, it could lead to a compromised immune system, and you may need to protect yourself by using vaccines. You know, these vaccines are still relevant.
By that, do you mean that people who are immunocompromised should now get boosters?
Yes, they need to get boosters, and even those who never taken a vaccine before, who might be now having underlying medical conditions, we encourage them to go and get a booster or get a shot.
The problem, though, with the people who never got vaccinated is that a lot of them were fearful of COVID-19, but also quite fearful of the vaccines themselves. So there was a lack of trust, there was disinformation, misinformation, and people who were just apprehensive because they felt they didn't know enough. It's been 2 years or so since the official vaccine rollout began. Many of those people will say, well, if they've survived between then and now, they don't think that getting a vaccine or not today would make a difference.
Well, Temeke, as you know, our bodies are not always the same. You know, you might have been healthier 2 years ago, but as time goes on, there are changes in our body. We might not be able to, you know, fight off the infection. So hence we encourage people to say, please, you might be having conditions now. You were healthier earlier on, but now you need something that is going to protect you. We understand that, you know, the issue of vaccines was not handled well in terms of explaining, you know, side effects and stuff like that. And there were misinformation, like you said previously, people being told that after 2 years they will die. You know, all those who are vaccinated will die after 2 years. I'm still here. I'm not going anywhere. I was vaccinated. So I think we just have to encourage people to go out there and get a vaccine, you know, if they want to protect themselves.
And what about the issue of efficacy? You remember initially we were going back and forth in South Africa. The conversation was around whether to take Johnson & Johnson or the other alternative, I forget the name now, Pfizer it was, and whether efficacy would wane against different variants and subvariants. Where is the science currently on that?
Well, there's the World Health Organization and its technical advisory group on COVID-19 vaccine composition. They continue to regularly assess, you know, the impact of these variants on the performance of COVID-19 vaccines to inform decisions on update and also on updates to a vaccine composition. So I think those are the issues that they are looking into. But as far as we know, you know, the current ones are still relevant. The current vaccine also protects against the EG5. But like I said, we might need an update at some point if we continue to have subvariants of this nature.
And are we past, Dr. Mzukwa, the point of worrying about the levels of testing, which was crucial initially in the very early stages of the pandemic when there wasn't even a vaccine available and we're all trying to figure out what this was to begin with? Does it matter how many people get tested? And I wonder now that none of us are wearing masks, there's a lot of bronchitis going around and other flu-related illnesses. Is there a higher chance at this point than perhaps 2 years ago of a misdiagnosis?
Yes, there is a higher chance of misdiagnosis. You'll recall, like you said earlier on, I mean, it's a flu season in South Africa. And you know that at this time, the symptoms are almost the same. So you might think that you're having a normal flu while actually you're having this subvariant. So especially if you are living with elderly people like our grandparents and stuff like that, you see, if you are suspicious that you might be having this, you might need to go test yourself. But even, with that, we still encourage that, let's put on our mask, especially if you are symptomatic. You are coughing, you are sneezing, so you need to protect those that are around you in the workplace as well, because you find that your colleagues might be having challenges, or you might be having children with underlying medical conditions. You want to protect all those people. So important to protect them by wearing a mask, even if you decide not to go and test. But please do make sure you protect them. Washing your hands, putting on your mask.
Dr. Mvuyisi Mzukwa, SA Medical Council Chairperson, good to speak to you. Thank you.